All right, so our objectives are to define pulse, identify normal pulse ranges for various age groups, define pulse rate, rhythm, and pulse, and identify pulse sites. Describe pulse rate, rhythm, and pulse.
Pulse.
All right, so pulse is one of the 4 vital signs that everybody talks about. It's the pressure of the blood pushing against the wall of the artery as the heart contracts. So remember, y'all learned about we talk about the circulatory system. It pumps, so it's like contracting, relaxing, contracting, relaxing. So it is that pressure of the blood that pushes against the walls of your arteries, which we got different parts of our body that has arteries, as the heart is going like this before it releases again. So the pressure of the blood pushing against the artery wall can be felt and in some cases seen at several pulse sites on the body. So as with all vital signs, abnormalities in pulse can signal disease. Pulse is the what of the blood pushing against the wall of the artery. All right. So it's the pressure of the blood pushing against the wall of the artery.
Assessing pulse. Pulse is assessed by 3 categories.
All right, so we got 3 categories that are used when you assess a pulse. So you got your rate, you have your rhythm, and then you have your volume. So rate is a number of beats per minute. So whatever that number is that you get, that's going to be your rate. Then you have your rhythm. That's the pattern of the beats. So what it means is if it's steady, if it's consistent, you have a normal rhythm. If it's not, like an abnormal rhythm. Volume is the character or strength, so how strong it is. So if it's a strong pulse, we say it's bounding. If it's not strong, we say it's thready. But we'll talk about that.
Pulse sites.
All right, so these are your common pulse sites. So if you take your fingers and you put it on these different sites, you should be able to feel a pulse. It is detected where a superficial artery has a bone behind it. So the sites are often named according to the bones or structures near where they are found. The most common pulse sites are radial and brachial. So that's the one that people use the most. Remember, in CPR, we use the carotid artery, the one in the neck, but that's usually only used for emergency purposes. Radial, brachial is where, like if somebody's just taking your pulse, that's what they're gonna feel for. And then these are all the sites, well, some of the sites that as a respiratory therapist, that's where I'll stick to get blood, because that's where your arterial blood is. But the most common site that I'll stick is radial. And then if I can't get radial, then I'll stick brachial. Femoral is, we'll use that in emergency situations. But these 3 are the ones we'll get blood from. So you have your radial, which is in your wrist, and it's going to be on your thumb side. You have your temporal, or temporal, however you want to say, tomato. Carotid, the one in your neck, that's the one we use for CPR. Have your brachial in your arm. Femoral is in your groin. Popliteal is like in your leg. And then you have your dorsalis pedis, which is in your foot. And then a lot of times when people are looking to see if it's circulation issues with patients, they'll take the pulse in the foot. Which of the following is a pulse site? All of them. All right, so which one is this one? Okay. Okay. Right here. Okay, this one. It's right here. Huh? You know what I say. This one. popliteal, and then this is your dorsalis pedis.
Palpation and auscultation.
All right, so palpation and auscultation. Palpation and auscultation are always ways to measure pulse. So palpate is like touch. Auscultate is listen. So palpation involves examination by touching with fingers or hands. Specifically, the fingertips are used when taking a pulse. The fingers are used to apply slight pressure to a pulse point so that the beats that are felt can be counted. The thumb should not be used because it has a pulse of its own, and it could be confused with the patient's pulse. So anytime you palpate a pulse, you'll take two fingers, your first two fingers, and you'll press down slightly where you're gonna find the pulse. That's what we did with, carotid. We did the two fingers, in your neck. But any other place, that's where you want the same thing gonna do. So auscultation involves examination by listening to the sounds of the body. Typically, auscultation is done indirectly using a stethoscope. Auscultation is used for taking apical pulse, listening to the heartbeat. Which method involves examination by touching with fingers or hands? Palpation. That's touch. You're palpating something, you're touching it. Which method involves examination by listening to the sounds of the body? Auscultation. That's listening. That's like using your stethoscope. You're listening for like heart. You can listen to lung sounds. You can listen to the heartbeats, or you can put it over your pulse sites and you can hear the beat there too.
Pulse rate. Average.
All right, so average pulse rate varies for men, women, and age groups of children, while many factors such as age, activity level, and overall health may affect pulse rate. The average resting adult heart rate should range between 60 to 100. And we talked about that in foundations. Y'all know 60 to 100 is considered what normal is. For children over age 7, the range is 70 to 90. For children 1 to 7, ages 80 to 110. Infants ranges 100 to 160 beats per minute. So, kind of like as you get younger, your heart beat will be faster. Increased pulse rate can result from exercise, stimulant drugs, excitement, fever, shock, nervous tension. Decreased pulse rate can result from sleep, depressant drugs, heart disease, coma, and physical training. Bradycardia is an abnormally low pulse rate of under 60 beats per minute. Tachycardia is an abnormally high pulse rate of over 100 beats per minute for adults. As with all vital signs, a normal pulse can signal disease. So, with pulse, like they said, if you exercise, heart rate should go up. If you take drugs, some kind of drugs that's stimulating, it should go up. Now, if you take something that's going to depress everything, your heart rate will go down. That's how, people will, like when they take too many pills, like overdose or whatever, heart and lungs work together. So if you are knocking out that respiratory drive with those drugs that you take, your heartbeat's going to start slowing too because you're not breathing. So, and then, also medicine can affect your heart rate. Not negative, but they can decrease it. And like when you're sleeping, when we're resting, heart rate should be, low and at, a good normal rate. If you got some kind of heart problems, you're in a coma. People that do like physical training, that like are always working out, stuff like that, they tend to have like lower heart rates because I guess they're just always, it's just a part of them or whatever. They're always working out stuff. Which range is the average resting pulse rate for adults? 60 to 100 for adults. Anything over 100, we'll say it's tachycardia. Anything below 60 for an adult, we'll say it's bradycardia. And some people walk around with like low heart rates, but the reading for your infant's pulse rate is 125 beats per minute. What should you do? This is for an infant. For an infant. Oh.
Simply record the reading in the patient's time.
Right, because for infant,
Pulse rate.
if you look for infant, 100 to 160 is normal. That I don't know if y'all have ever known somebody that had a baby, or y'all like to watch people on YouTube. I don't know, but if they're when they go in to be monitored, when they have a little belt on, and usually the heart rate high, because they be like, oh, if it's this number, it's a boy. If it's this number, it's a girl. So their heart rates are going to be higher than what we consider normal. So 100 to 160 for infant. 100 to 160 infant. 60 to 100 adults. 70 to 90. And then 80 to 110. Right.
Pulse rhythm.
All right, so pulse rhythm is described as regular or irregular. Regular pulse rhythm has an equal spacing of beats. Irregular pulse rhythm does not have equal spacing between beats. So what it means is like when we're doing chest compressions, and we're trying to keep that steady 100 to 120, that's your rhythm. You want your rhythm to be consistent. If it's regular, that means they have a regular consistent beat. If it's irregular, it could be like all over the place. Some people they skip beats. Beats are like real close together, so that would be irregular. Arrhythmia is an abnormal rhythm. I think we talked about that when we did CPR. Arrhythmia can be caused by a defect in the electrical conduction pattern of the heart, or by blockages in the coronary arteries of the heart. So, arrhythmia means something's going wrong. Something's not in the heart is off. Sometimes arrhythmia is those shockable rhythms that we can do for CPR. Sometimes it's just an arrhythmia. So. All right, so pulse volume can be described as strong, weak, thready, or bounding. Volume is often recorded using numbers. So 0 is absent, unable to detect. So that'll be like asystole. Thready or weak, difficult to feel, easily stopped by light pressure from fingertips. 2 is strong and normal, easy to feel, able to be stopped by strong pressure from fingertips. And then 3 is bounded and full, difficult to stop with fingertips. Some people's pulses you can see like through the skin, like that's bounded, like you can see a beat through the skin. Of course, I look at this stuff because that's where I have to get blood from. So I'm always looking at people's wrists, so you can see the ball, and you can even see them like in their neck. It'll be bounding coming out. So that's what bounding means. Strong, probably what we all got. Strong pulse. Thready, like you barely feel it. If it's faint, it's there, and then absent, that's not there at all. So that's what all those things mean as far as volume. Which pulse assessment can be described as strong, weak, thready, or bounding? Pulse volume. And which pulse assessment can be described as regular or irregular? Pulse what? Pulse rhythm.
Apical pulse.
So then you have your apical pulse. It's a patient's heartbeat. A stethoscope is used to take or auscultate apical pulse. So the diaphragm of the stethoscope is placed over the apex of the heart. So your diaphragm is this part here, that part there, and this is your bell. Heartbeats are heard and counted for 1 full minute. Apical pulse might be used for infants or small children and for patients with certain illnesses. And I got a video that I always show because I know, like, I'm a more of a visual, like, learner. Like, I have to see it. So that's why I'm always on YouTube looking up stuff, like when I'm crafting, looking at stuff, because I have to see it. Like, just reading it, it's not gonna click to me. So I have to have an example to look at. So I'll show y'all that after lunch.
Apical radial pulse.
Apical pulse and radial pulse should be the same. For example, if a patient's heartbeat 60 times per minute, then 67 times per minute, then 67 pulses per minute should be counted at the wrist. If fewer pulses than heartbeats are felt, it is called a pulse deficit. A pulse deficit can occur if the heart is too weak to pump enough blood to produce a pulse. It can also occur if the heart is beating so fast that the heart cannot fill with blood. The pulse deficit is the difference between the apical pulse and the radial pulse rates. It is determined by subtract the number for the radial pulse from the number for the apical pulse. At which location is apical pulse taken? Apex of the heart, right? And then pulse deficit means that the apical pulse and the radial pulse are the same. If it's a deficit, they won't be the same, right?
Lesson summary. In this
All right, we'll go get y'all's lunch. We'll go through radio and apical when we come back.
What you'll learn. After you finish this lesson, you will...
All right, so objective for this part is to take and record a radial pulse.
Procedure for radial pulse.
So I think this is the checkoff sheet I gave y'all. So you'll wash your hands, you'll introduce yourself, you're gonna identify your patient, you're gonna explain what you're gonna do. You're gonna put the patient in a comfortable position, providing support under the arm and turning the patient's palm downward. So if you're taking a radial pulse, your radial artery is on. It doesn't matter which arm you do or hand. You want to make sure that the person's palm is downward, that you're able to get to that, site. So using the tips of your first two fingers, so as you can see, like right here, you're gonna find their pulse on the thumb side of the wrist. So your radial is on your thumb side right here. Do not use your thumb. Your thumb has a pulse in it, so you don't want that picking up the, thinking that it's the pulse of the patient. So when you find a pulse, you're gonna apply gentle pressure. You're gonna use the second hand of the watch or clock and begin counting pulses for 1 full minute. So every time you feel a beat, that is 1. So you're gonna count for 1 full minute. So I know y'all don't have, like, if you got a watch with a second hand on it, you can use that, or you can use the timer on your phone. So for 1 minute, you're gonna count. Once you're done, that number is gonna be what the pulse is. Okay. So in some places you can count for 30 seconds and multiply by 2, or you can count for 15 seconds and multiply by 4. For us, just count. Just do it for 60 seconds and just get that number. So when you're counting the pulse, you want to pay attention to the volume and rhythm of the pulse.
Procedure for radial pulse.
All right, so I think I gave y'all on that paper. Nope. The paper I gave y'all last time y'all was here. You should have. You was here. It should have okay, y'all. What's the other one? So this is your actual, like, steps, and then this one is where you'll put your information. So you got date, time. We haven't done blood pressure yet. Right now we're focusing on pulse in the P column. So you'll put date, time, pulse rate, pulse volume, pulse rhythm. You're going to check the patient, observing all safety precautions. You'll wash your hands, record the data on the patient's chart. So date, time. So they got a P for pulse, 75 strong, regular, your signature, and your title. So if you have any abnormal data or observations, you'll report it to your supervisor, of course. Use your thumb to take a radial pulse. Pulse. While counting pulse, what must you be aware of? Volume and rhythm. All right, so what's the first step in this whole little process here?
With your first two fingers on the patient. No, hello. Okay, the first
Huh? Right. These two out away. So you're gonna put them in a comfortable position. First two fingers, you're gonna find the pulse on the thumb side of the wrist. That's where your radial pulse is. Count for the appropriate amount of time, which will be 60 seconds or 1 minute. You're gonna pay attention to the volume and rhythm of the pulse. Record the data. Which is the correct way to record pulse data? Right. Which is an acceptable way to measure pulse? All of them. Because you can count for 30 seconds and multiply by 2, count 15, multiply by 4, but we want to count for 1 full minute.
Lesson summary. In this lesson,
I'm going to show you this video. If I can find it. I might have to go to I'm gonna put it in y'all's folder. I haven't yet, but it's on. Who is it on? It's on my PCT class, I think already. Already got it in here in that folder. Let's see. Oh. Put the video. Where did I put the video in? Nope. I'll just keep it. Oh, I see. Yeah, she can.
One could say I had some struggles with nursing school.
I struggled throughout nearly all nursing school.
I wish I discovered this sooner.
Hey everyone, it's Sarah with RegisteredNurseRN.com, and today I'm going to demonstrate how to check the radial pulse. To do that, you'll need to perform hand hygiene and explain to the patient what you will be doing. Next, we're going to check the patient's pulse, and as we feel the pulse, we're going to be looking at several things. Of course, we're going to be counting the rate, but we're also going to be feeling the strength of the pulse, and we will be grading it on a 0 to 3 plus scale, with 0 being the pulse is absent, 1 plus weak, 2 plus normal, and 3 plus bounding. And the rhythm, is the pulse regular or is it irregular? Now in adults, the most common site to use to check the pulse is the radial artery because it's really easy to access. So it's found, what you want to do is find the thumb, and it's found below it in this wrist area along the radial bone, hence why we call it the radial artery. And whenever you're checking the pulse, have the patient, they can sit in bed, they can lie down, and you'll want to support their arm, extend it out and support it. And you're going to use your first 3 fingers to feel the pulse. Don't use your thumb. Your thumb actually has a pulse in it. So use your first 3 fingers and find it within that area I just told you. And lightly just touch it. Don't press too hard. And feel the bounding of the pulse. And what you want to do is you want to count it for 30 seconds if the pulse is regular and multiply that number by 2. If it's irregular, count it for 1 full minute. So his heart rate is 82, it's regular, and it's 2 plus. and a normal heart rate in an adult is 60 to 100 beats per minute. Okay, so that wraps up this video on how to check a radial pulse. Thank you so much for watching, and don't forget to subscribe to our channel for more videos.
Okay, so what y'all gonna do now? I want you to do 2 different people, and I want you to check their pulse. So that paper y'all got with the all right, so on the signature line, no, that's supposed to be for the signature. But in the signature line, put your name. I mean, put the person who you are. I ain't gonna put it. Yeah, I want to get one. You were sensitive because we went back there and you was on the scale. Y'all better quit. Let me tell y'all something about not losing y'all stuff. I only make enough copies for. Was it that paper with all them sheets? Yes, you were here. So where it says signature, you'll just put whoever it's gonna say. Oh, no, I'm in here. Say she does CJ, she just put his name right here. So we're just doing quotes today. So you'll record his quotes. And say you do Shamari, you'll do her quotes. We're just looking at this one. And you can look at the radio post check off if you need it.
What's it called?
Alright. So what we put her name? Where's their signature? Just put their name right there. Alright, let me print off how many?